This original WSRE presentation is made possible by viewers like you. Thank you.
Good evening, welcome to CTC, Connecting the Community. I'm Lloyd Patterson. If you've traveled in other countries, you know that not all water is the same. The U.S., including Northwest Florida, of course, has among the safest water supplies in the world. So, what's behind the report by the Environmental Working Group showing water from ECUA wells the worst of the systems tested? EWG, a leftish nonprofit, found 21 chemicals exceeding health guidelines in ECUA water versus a national average of 4. It found 45 chemicals versus a national average of 8. And ECUA water tests conducted about 75,000 versus a national average of 420. Now, these are some of the contaminants found in ECUA water that exceed health guidelines according to the study. Most of them have names about a block long. But of course, saying that there are things that in the water is not the same thing as saying that the water is dangerous. Let's get it all cleared up now with our guests tonight who have many years' experience in testing and studying water. Dr. Richard Snyder, University of West Florida professor, director of the Center for Environmental Diagnostics and Bioremediation. His experience goes back almost 30 years. Pat Byrne has 3+ decades of water and wastewater engineering experience, helping design major projects for the City of Tampa's water system. He is now the Deputy Executive Director of the Emerald Coast Utilities Authority, in charge of utility operations. Christy Draper has 20 years in the environmental analytical chemistry laboratory business, last 10 years specializing in drinking water. She works at PACE Analytical Services. And Dr. Robert Menzer is a retired scientist with the U.S. Environmental Protection Agency, who has also taught and written extensively in professional journals, including papers on drinking water and health. Thank you all very much for joining us here tonight. We're talking about the safety of our drinking water, and that's a very important subject. This study that came out not so long ago must have concerned a lot of people, lead them to think that there's something wrong with the water that they're getting from ECUA. And let me first of all go to Pat Byrne. Your quick response when you saw that study, what'd you think?
I was ready to do battle. We're proud of the quality of water that we provide. We knew that we met all of the regulations. That doesn't mean that we didn't agree with the agenda that the Environmental Working Group had. They're trying to regulate more of the chemicals. It's just that we felt like we were collateral damage to their agenda.
Dr. Snyder, what did you think when you first laid eyes on that study?
Well, I agree with that. And actually on the way here to the studio, I heard a story on the radio about a young woman who rowed across the Atlantic Ocean. And they asked her why she did this. And she said her reason for doing it was to promote safe drinking water across the globe. That was her issue. Well, the same issue as the environmental working groups, except they chose a different way to draw attention to the issue, and that was to make local utilities look bad and to get people upset and to get people talking about safe drinking water. But they did so at the expense of people's confidence in their drinking water supply.
And that you don't believe is right?
It was not scientific, no.
All right, Christy Draper, you saw the study. Did your eyes bug out and say, what's going on here?
Absolutely. I had to question where the data came from, what was the background of it, their statistics, their database, because I see water from all over the country, and I know that there's some utilities across the country and other locations that are actually not in compliance. So to say that our water's worse than a utility who's not even in compliance did not make any sense to me.
Makes no sense to you. Dr. Menzer, what do you think about it?
Well, I thought when I saw it originally that they had misinterpreted some of the really basic principles of understanding water and its quality. For example, the EPA has what they call MCLs, maximum contaminant limits for all drinking water. And they also have another term called maximum contaminant limit goals, MCLGs. And apparently EWG simply rolled both of those terms together into one standard, which is just not right.
So in all of your minds, this study has been pretty well debunked. Is that safe to say?
Well, I think from a scientific point of view and from a public information point of view, it is not very useful. But they did achieve their goal, which was to get people very upset and to get people talking about drinking water standards, because they are after increased regulation on drinking water. So they were very successful in what they did, but they abused the system, to my mind.
Well, don't we have agencies, federal, state, local, all looking at our water and making sure that it's safe? Is there a need for greater regulation of drinking water in this country? Dr. Menzer?
Yes, I can answer that. You have to go back to 1974 to understand the current state of drinking water regulation. Congress passed in 1974 the Safe Drinking Water Act, which charged EPA with establishing standards for what they called in the law dangerous contaminants of water.
Now, let me stop you right there. Before that time, was our water unsafe in a lot of parts of the country?
No, it wasn't unsafe. It just wasn't tested as rigorously as the Congress thought it should have been.
All right. So 1974 is when it started. Now, since that time, those have been constant updates in the water testing regulations. Isn't that correct?
Yes, there's several things that we're involved in right now that will expand the number of contaminants that are regulated. EPA's process involves two lists. There's a candidate contaminant list. We've gone through two of those. There's also an unregulated contaminant monitoring report. We've done two of those. What they're doing is they're looking for the occurrence of these contaminants in the environment to see whether or not they really are of harm, whether or not they're occurring frequently enough to deserve regulation. Understand that each one of these contaminants that we test, Christy can tell us how much it costs, but each time you add another contaminant or another parameter to that list, you add the cost of operating the water system considerably. So we're still looking at expanding that list through EPA's program. When that occurs, we do not conduct the actual testing because these are new contaminants. They have to develop a set of standards for them. And so EPA will have several labs that they will select. We will collect the sample. We send it to a lab that has been qualified, but we don't actually do the testing.
Do we know that that all the chemicals that are dangerous to people are regulated the way they should be in this country? Dr. Snyder?
Well, there are a number of things that are constantly on the radar, and the research is way ahead of regulation. And when we look at getting things to the regulatory realm, there's a lot of review that has to occur. Not only do we have to make sure that we are regulating chemicals that are important to regulate, as Pat says, they have to be there. Why regulate something that isn't there to begin with, that isn't a problem? But we also have things that we just don't know enough about to really come up with good regulations for them. For example, the issue of pharmaceuticals and antibiotics and various other compounds that are in the wastewater stream. We're getting these back into the environment. In some cases, they're recycling back into our drinking water. And those are years and years and years away from being regulated, but we're aware that they're there. We just don't have enough information to really know how much of a problem that is.
And it's easy to drum up scares when it comes to water, and people don't, I don't understand chemistry, and people, I'd say your average person, the consumer, doesn't understand it that well. So if they see some story that says this X chemical is found in water and it's been connected to cancer in mice, and then your automatic response would seem to be, well, gosh, you ought to do something about it. But it's not that simple, is it? I mean, you got to know what levels and where it is. Christy?
Well, correct. This UCMR program that was discussed, we're in the final year of UCMR 2, which looks at different chemicals in the water. And I just spoke to the EPA water group out of Cincinnati last week, and they've already have on the books the UCMR list 3 list, which will come out in 2011, will be published, and then they'll actually implement that program, which will be a national survey in 2013. That's not a lot of time to develop methods. This instrumentation used today for these contaminants of concern are very high level. We're talking pharmaceuticals, flame retardants, personal care products, the like. So it takes a long time to develop methods, and EPA has to develop and promulgate methods before the labs out in the survey can actually implement them, buy the instrumentation, and get the methods set up and working.
Yeah, I want to talk about the instruments in just a second, but Dr. Snyder, you had a comment on that?
No, and she
Okay.
said it very well.
Okay.
Well, they have accelerated their program. I mean, every 6 years or so, they're reviewing things, and it's an ongoing process. And before they've even analyzed all the data from UCMR2, they're going to be starting into UCMR3.
All right.
Actually,
Go
that's
ahead,
one
Doc.
of the things that the original law required. EPA was charged with establishing regulations for certain chemicals at that time, but they were also charged with keeping up with developing science so that they were to publish this list on a periodic basis to update the original list.
Okay.
As
We're
the-
talking about the ECMR and all this stuff. You're talking about things that are there that the EPA is looking at that might be taken action might be taken in the next few years, not the stuff that's currently regulated, right?
Correct.
Correct, yes.
And in particular, one thing I wanted to bring out is that when we completed our UCMR2, we had no hits in either UCMR 1 or 2.
No hits meaning?
Meaning that it didn't occur in our system, which is one of the reasons for that survey. Once they go through the systems and see where it occurs, then the regulations can be made more reasonable. If you don't have it, why look for it?
Okay, if you just joined us, we're talking tonight about the quality of our drinking water, particularly water provided by the Emerald Coast Utilities Authority. You might have seen a report out a few months ago that suggested that the water, there was something wrong with it, and in fact it was the worst water they tested in the country. Now, that report has been largely discredited, but there's still a lot of interesting things to say and know about our drinking water. And one of the things I want to know is what is threatening our water supply, our drinking water supply today, and how does it get into our water?
Presently, one of our biggest threats is from dry cleaning fluids.
Dry clean. There's
dry
enough
clean,
dry
TC
cleaning places that.
TC and PC. We're talking about things that happened in the past. Unfortunately, it doesn't just show up right away. It takes it a while to move through the aquifer and enter the system. The other source that we get are the leaking underground storage tanks. Florida's been very proactive in its early detection incentive program. However, when you look at the number of leaking storage tanks that have been reported,
Gasoline storage.
gasoline storage, you're talking about some pretty large numbers. There's also pesticides and other things that might get into the system, but primarily what we're seeing that's affecting us is coming from service stations and from old dry cleaning sites, and it's mostly in the older area of the city. We currently have wellhead protection ordinances that the county has to help us prevent the installation of any potentially contaminating activity within that wellhead area. A wellhead area is simply the delineated area from which we're likely to withdraw water.
And the ECUA has a lot of wells. It's pumping water all over the area.
We have 32 wells. 10 of the wells have granular activated carbon units on them because of contaminants. 3 of the wells have carbon units really for iron, not for any of the contaminants.
Richard, Christy, what concerns you about what is a threat to our water system today, and how does this threat, how does it get into our water?
Yeah, people need to understand that our drinking water comes from what we call the superficial aquifer. That means it is directly recharged. The water is coming from the rain and filters through the ground and is held in the aquifer, and we're pumping it back for drinking water. That means that if you're changing the oil in your car, don't dump the oil on the ground because it's going to go right into our drinking water. That's why we have legacy problems with dry cleaning fluids. The dry cleaning plants, if they spilled some of the cleaning fluid, We're talking about parts per million, parts per billion in some of these chemicals, and it doesn't take a whole lot of dry cleaning fluid to contaminate a whole lot of drinking water. And anything that's put on the land surface here locally is likely to get into our groundwater. So people need to be aware and maybe a little careful about what they do on the land surface.
So it's more, the contamination that we're seeing today is more likely to be some guy changing his oil in Gonzales, and he dumps the oil in the ground, or it spills a bunch of it. That's the big threat?
Well, there also is a concern of increasing nitrate levels, and some of that is coming from drain fields, from septic tanks, and agricultural use of fertilizers and urban use of fertilizers. A lot of that nitrate nitrogen will percolate down into the groundwater, and over time we do see nitrate levels going up in the groundwater.
Is the average home septic system a threat to the cleanliness of our drinking water system?
I think that depends on where it is. EPA actually has a manual out for individual treatment systems. Some of the systems are somewhat sophisticated in that they add air and they actually try to do some nutrient removal. Again, it's where it's located, it's the quality of the soils, proximity to water bodies.
Our soil around here is pretty sandy. Is that good for?
That just means things are going to take off and go someplace. You know, the sandier it is, the faster it's going to move. You know, one of our concerns has been the Humphreys well. We currently do not use that well except in the event of a fire or an emergency. Humphreys is located near a station that has free product in the ground below that station. If we were to pump Humphreys consistently, we would see levels, BTEX, benzene, toluene, ethylene, xylene, we'd see levels climb if we pumped that. What we found now is by idling that well and only using it for emergencies, that we're well below any contaminant limits. So we're going to leave that well offline unless there's a fire. Fire comes, we'll turn it on, and we've got granular carbon units on it. Not likely that a fire would put enough through that unit to load the unit.
Now, you're going to give us water that's going to come out of the aquifer, and you're going to make sure that that water is clean as it's pumped out. But it has to go through lots of pipes, and it gets to my house, and it's got to go through our plumbing. And how do we know? How do we know it doesn't get contaminated someplace along the way after it leaves the well?
Well, as a matter of fact, that does occur on occasion, and when that does, we put a precautionary boil of water notice on your door knob. The way that occurs is, unfortunately, despite laws for people to get location before they dig, contractors tend to find our pipes with a backhoe. So when there's a break in the pipe, there's always a certain amount of inclusion that gets in there. The other thing that happens is, regardless of whatever we do with the water, over time there are minute sediments that gather and collect in the invert, the bottom of the pipe. So a sudden break creates a sudden flow, and those velocities resuspend that material that may have been there for years. It's not necessarily unhealthy. It may just be calcium, because we do have to add lime to the water in order for you to be able to drink it. Contamination can occur in that manner, but also we went through a lead and copper evaluation, and some of the old services to the houses had lead goosenecks. Some of the homes were built in the pre-70s. Some were built with faucets and components that tend to leach lead. Also, the solders that were used in the copper pipe tend to leach lead, as well as the pipe. So what we have is more than 100 homeowners who volunteered to go through the lead and copper sampling. The homeowners sampled it at their tap. We then send that out for testing, because that's not one we can do in-house, and look for the lead and copper levels. In order to counteract the tendency of our water to resuspend or to dissolve lead and copper, we add orthophosphate. And the orthophosphate basically has controlled the lead and copper, and we've been well below limits in the system.
So when we get water out of our tap at home, it looks clear, but it's not completely free of chemicals, is it? There's chemicals.
That's correct.
There's chemicals in that water.
That's correct.
It's
not
pure
sterile,
water.
and it's not pure, and actually pure water does not taste very good.
Is that right?
Correct.
You wouldn't want pure water. Why is that?
The minerals actually give it a characteristic flavor, and people pay big money for bottled water that's actually quote-unquote mineral water.
And you'd want to, that's why you go to some other places, you go to other cities, the water tastes different to you, is because it has a different mineral content?
Mm-hmm.
Is that
That's correct.
what we're tasting?
Our water, in fact, won the taste test for the region a couple of years in a row. And it was very interesting that one of the years that it won the test was when a couple of the judges that were testing the water were pretty mad at ECUA. Yeah, but they still decided that our water tasted good. If you've ever had distilled water, that's a good example of how bad water can taste in my book. And yet there are people who distill their water, put it in their plastic bottles, and they drink it. They like distilled water. I can't stand it.
Is there a health benefit to doing that, Dr. Menzer?
Well, they have taken some chemicals out of the water, but by putting it in a plastic bottle, they've added plasticizers to the water too. All of these chemicals are actually regulated. Copper and lead, for example, are two of the what is it, something like 80 chemicals now that are on the regulated list, and probably there's 300 or more that are on the candidate list. So we're looking at a whole lot of chemicals that are possibly in our water. Doesn't mean they're there, but someplace in the country they may be there, so they're regulated.
Now you could make water safer. Is that safe to say? You could make it safer, but could you do it and make it more affordable? I mean, you can't charge $1 a gallon, I don't suppose, for your water. You have to make it, water has to be affordable, and then it has to be balanced with safe. So how do you strike that? Has ECUA struck that balance, do you feel? Dr. Snyder?
Well, it is a balancing act between the regulation, what's feasible, and what's affordable. I mean, we have purification systems in our laboratories that make ultra pure water. You can't do that on a utility-wide scale and produce waters. There's also getting back to something we were talking about earlier, there's two sets of water quality criteria that we're talking about here. One is what's regulated. Those are the chemicals that carry some health risk to them. And then there's a whole other set of things that are aesthetic qualities. There are utilities that meet the regulatory requirements, but people don't drink the water. Like in San Diego, for example, most people don't drink the water because you'll gag if you try to drink it. It's just got so much salt in it. But it meets all the regulatory requirements. So there are two different issues here in terms of drinking water quality. One is it drinkable, and other, is it safe? And I think ECUA does a very good job of making it safe because they comply with the existing regulations. There are utilities that do not, and that was one of the things that was evident in the Environmental Working Group report. They said ECUA was the worst, but on average there are utilities out there that do not even make the regulations, that exceed the regulations, and they consider those to be better water.
All right.
Understand too that EPA has the regulatory limits, but we have state primacy in this country. Therefore, every state has to adopt the EPA regulatory limits, or they can enforce something more strict. And we're fortunate in Florida in that they've done that. They're one of the most forward-thinking states, I think, in the country. They not only add other chemicals to the list above and beyond EPA for state testing, but they lower some of the limits below what EPA requires. And we still meet all that criteria here at ECUA.
We're showing some of the websites that you can go to for some great information about water quality, UWF, EDU, CEBD, and the ECUA.org has some great info. And there's the environmentalworkinggroup.org if you'd like to know more about what they're up to. We're down to our last few minutes, and I really want to find out, because you guys really know your water. Now, do you have filters on your faucets at home? Do you recommend those things? I'm not asking you to endorse any company's product, but does that make sense to you? Would you make your water better if you put the filters on it? Dr. Menzer?
I think you might remove some things that will change its taste, but to make it safer, I don't think so. I get my water from Gulf Breeze, not from ECUA, and we don't filter it, and we don't have any problems with it.
Okay. Dr. Snyder, do you filter your water?
I get my filtered water through the refrigerator. Some of them have built-in filters. And the thing that I object to is the aesthetic qualities of the chlorine. I don't like coffee with chlorine or drinking water with chlorine. And so I like to put it through a filter that'll take out some of the chlorine, or just leave it sit in a pitcher and let the chlorine off gas. But I'm at the university every day, and I don't drink filtered water up there. And that's ECUA water.
And what about you, Christy?
I do not filter my water, but I will say that some of the minerals will come out into your coffee maker or your iron, so you might want to filter it so that you don't get that crust that you can sometimes get also on your taps and the like. As for lead, I think one of the things, if you're in an older home and your home itself may have lead solder, one of the things you can do is just let the water run for a few minutes if it's been standing for a while, because when you do the copper lead test, you do what's called a first draw, where the water's been standing in your pipes for at least 6 hours or more. Then you go back and you do a second draw after you've purged it. So one of the best things you can do for lead is just to open up the faucet and let it run for a little while.
Good advice.
That's actually an EPA suggestion.
All right, that's actually suggested by the EPA. Pat Byrne, what about, is it against the rules at ECUA headquarters to have filtered water or bottled water at your desk?
If I go in an office and they have bottled water, I am not very friendly about it. However, I think people should, if they're comfortable drinking bottled water, drink bottled water. I don't particularly care to. I have some concerns about the bottle itself. The only concern I have about the filters in general is that people tend to see what collects on the filter, and of course it's usually brown, and now they become alarmed because their filter has brown stuff on it. Well, all that means is the filter did its job.
What's the brown stuff in there that it
Oh,
filtered?
well, it's usually calcium carbonate combined with a little bit of, we may have a small amount of iron. It takes just a smidgen of iron to colorize it. But, you know, filters are gonna load up. So it's not gonna be any better than the maintenance that you give it. So if you're gonna use a filter, you need to change it regularly. The other thing I don't particularly like about the filters is that if we have a disturbance in the area, we're gonna load your filter up quickly. For example, a contractor breaks the line, you know, a block away from you, or there's a fire in your neighborhood and those velocities in that line pick up. Your filter's going to load up. So after an event like that, or after you get a precautionary boil water notice, once that notice is lifted, you should change your filter element.
All right. Pat Byrne, the Deputy Executive Director, Emerald Coast Utilities Authority, thank you very much for being with us. Dr. Snyder from UWF, very interesting having you here. Christy Draper, keep testing that water. And Dr. Menzer, thank you very much for joining us today. It's been very interesting hearing what you had to say. More information at the websites that we have listed. Thank you for joining us on Connecting the Community, and stay tuned now to WSRE for more great programming from WSRE PBS for the Gulf Coast.